thank you again. Man, up to that point, I ain't never, been in that position before.
The end of the week was a intra-squad scrimmage game where the coaching staff basically split up the two halves of the USA basketball camp. In the middle of the last quarter, we had a little event which sort of changed things significantly.
It was just a shock, I remember everything going through my head was, did this really just happen?
I was more concerned that he had hit his head on the court, because that's really what it sounded like to me, like a thud almost. By the time I got over there and saw that his head was okay, the trainer sort of looked down at his legs, and that's kind of when I realized, okay, it was really necessary to sort of spring into action.
Doc and the OKC trainer both rushed over and kind of held me down.
He had a fracture of the leg. It's called a compound fracture, where the bone exits the skin, which quite frankly is a relatively common injury in ERs, certainly not on basketball courts. At that moment, I sort of activated and realized, okay, so what are we dealing with here beyond this? Is there some sort of vascular injury or some sort of nerve injury? I'm already thinking, okay, the bone we're going to deal with. The bone is what it is, and that is probably the simplest thing to deal with. However, if I don't recognize that the blood vessel is kinked and there's no blood supply going to the foot, that's minutes of time that I have to sort of correct that. I did have to rotate his foot to reestablish some of the blood supply. Because in my practice, it's not just, oh, is the bone going to heal? The question is always, when am I going to be able to play again?
It kind of was that blanket for me, and I was very appreciative for that.
Inside the ambulance, I kind of have one arm on his leg to kind of stabilize him. He's very tall, so a standard stretcher really didn't fit him. He had his parents in there with him, so they were a calming influence, which was good.
I actually got a funny story because I was upset with Doc in my mind because we went to one hospital. We were actually about to arrive to the hospital, and he's like, no, 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 no. I have a better one to go to. So we had to leave that hospital and go to the other one.
So I had basically his leg in one hand, and then I'm talking to the doctors and ER staff at Sunrise Medical Center to sort of prepare for his arrival, which just they were. It was really, really quite great by the time that we arrived there. Everything really went very smoothly.
So I was very thankful again that he put me in the right hands to make sure that they were going to do the best that they could.
Indiana Pacers' Paul George would like to thank Brooklyn Nets and Team USA physician Dr. Riley Williams for his help and medical guidance last July when Paul broke his leg while with Team USA. As a personal thank you, Paul is now presenting Dr. Williams with an autographed jersey. Let's hear it, Nets fans, for Dr. Riley Williams.